Good afternoon, everyone. I am Patty Cantrell with New Growth, the Community Development Corporation here in rural West Central Missouri. Very excited to have you all on here for our webinar today featuring New Growth Transit. I'm just going to give you a little preview about New Growth and the Start Here Business Acceleration Network. We are your hosts today. And then we will hand it over to Kelly Ost to tell you more about this program and how it's been developing and growing. Please, as always in webinars, there is a Q&A button at the bottom. Please put your questions in there at any time. We will definitely have time at the end for questions, and we will have a discussion. I will also be able to get you off mute, and so you can talk directly with Kelly. I'm going to try to do that later. But please do that. I'll be monitoring that. And of course, there's also the chat to talk if you need to reach me on anything. So again, this is hosted by New Growth, and I am going to show you a little bit about what goes on at New Growth. And there's a lot of logos here, but up in the upper left is New Growth. We're a rural community development corporation, and we were started in 2017-18 by West Central Missouri Community Action Agency. That's our parent organization. And our whole effort is to try to grow good things here in this rural area by building on our assets, our rural roots. And the work that we've been doing has been really developing along those lines. New Growth Transit has grown out of that, trying to address a really key issue for everyone in our rural area. We've also been looking to grow our entrepreneurial ecosystem, to really grow our rural businesses. And so New Growth is now also home to a microfinancing effort called New Growth Capital. We are an SBA microlender in a 15-county region between Springfield and Kansas City. And we've also been trying to put more boots on the ground to work with rural businesses. And so we have an SBA designated New Growth Women's Business Center in that same 15-county area. And that does serve men and women in the rural area. We have a food systems program also incubated and organized in conjunction with our parent, West Central Missouri Community Action Agency. And that group has really been working in the greater Kansas City area, rural and urban, to build all those supply chain connections from small farms to those markets that are looking for local and regional food. The most recent development on that, and the final logo I want to show you, is that our New Growth and our food systems program is a partner with and a co-director of a brand new 5-state Heartland Regional Food Business Center. It's one of 12 in the country that's getting started at the end of 2023 here. You can find information about all this at newgrowthmo.org, and of course our parent website as well there. So a lot of all this has grown because we've been working very intentionally with our partners in the region to try to connect and cultivate and build what we say are in our rural area. Our assets are really kind of scattered, stranded, and starved. And so we need to work together to make sure we leave no entrepreneur behind and make sure we can grow together. And these are the partners that are active in our Start Here Business Acceleration Network. And this is really about making sure entrepreneurs get what they need at the right time, including transportation. And, that it's all connected in here in this region, working together on these issues. So the Start Here Business Acceleration Network and New Growth are really happy to have you here. We will be hearing now from Kelly Ost. She is our Regional Mobility Chief Officer, developing and operating New Growth Transit. She's got a great presentation for you. Don't forget to put your questions in the Q&A box. I'll be watching that, and we'll try to get your voices on the screen later too. All right, take it away, Kelly.
Thank you so much. All right, if we can, my name is Kelly Ost, and I am with New Growth Transit. And we are developing transportation solutions for rural Missouri. And so as we begin here, I think it's just very important to understand the intention of New Growth, and we are an affiliate of West Central and our parent organization, West Central. And we had spent years listening to residents that were isolated and stranded. And what we mean by isolated is residents that had little to absolutely no public transit option, and stranded were residents that maybe had transportation one way. And so here is the map of our service territory, and you will see in the navy color that that is the West Central Territory. And so these were the original 9 counties that we worked within, and I'll explain the model timeline and some of that here shortly. Additionally, shortly within 3 years of working in the network, we expanded our service area to Dallas County and to Jefferson Franklin. Jefferson Franklin County is a sister community action organization, and so we worked with them to launch their own transportation network. Their transportation network is a little over a year functioning, and so they've also built a task force with community stakeholders. Dallas County, you'll see here also in the blue, is a very small community. We had the opportunity to work with their community foundation and a champion volunteer, Milo Kelly, and the economic development team there. And they came to us, told us their story, and then they actually put together funding throughout their community to bring our services before we could get funding to help pay for rides. So those were very encouraging partnerships that were formed last year. Then in this year, the rest of 23 and through 24, we will be expanding in Barton, Jasper, Polk, and Camden County, as well as Dallas County. And we have funding to offer ride coordination services, start to recruit and train volunteers, and also pay for rides. And then we do want to highlight those requested service areas that we've had from other parts of the state. We hear you. We're excited to hear from you. But I think what we're trying to show here is that there is lots of interest in rural Missouri and also some of these suburb areas, trying to find more options for rural transportation services, because what we do offer in the state are definitely at capacity. So let's talk a little bit about who we're serving. When we look at transportation, this came out of West Central, our parent organization's community needs assessment. And to gain this information, we talked to individuals that are income eligible, clients of some of the programs. We talked to community stakeholders, our board members at the agency, and then staff. And I really think what's interesting about the responses that you'll read here is that it's not just one sector that needs more access in communities. Anybody and everybody deserves access and needs access. And so oftentimes when there is an issue or a challenge with transportation, we see that there is a lack of funding. Some people think it's just gas, but actually that funding for registering a vehicle, paying taxes, and even repairing that vehicle. There's sometimes there's just a lack of education or understanding that people feel intimidated by the process of insuring and maintaining and registering a vehicle. Also, like I mentioned earlier, a lot of our rural areas were identifying and seeing the challenges with limited to no access to public transportation. And when they did have public transportation, oftentimes it's long wait times. And these are not hours within a day. At times, these are days that get categorized as wait times. Limited transportation for medical appointments was what was voiced as one of the most divergent needs for non-emergency medical, and then just general availability for other things such as employment, childcare, access to groceries, schools, and other necessities. And what I'm excited to show you later in this webinar is that we're showing that diversity of need, and we're seeing how it's growing across our region. So let's talk about our model development. This was very much community focused from the beginning. We knew that transportation's expensive and a lot of communities can't afford large, robust systems. It tends to work in other areas where there's density, and in these rural communities, we're dealing with distance. And so we started to work collectively throughout the communities. In 2019 through 2020, we were funded by HRSA to start a network strategic plan. And what was really interesting to us is that 40 regional partners joined those conversations. By our second conversation, we had reached out to the majority of non-emergency medical partners. And by the second conversation, those partners said, where are the employers? So we were learning very quickly in that 9-month process that anybody and everybody needed to be at that table for transportation. Following that strategic plan, Missouri Rural Health Association supported our efforts by supporting a mobility management contract. And we were able to have one individual on staff that could focus just on mobility management with communities we served, and in addition to looking at launching a volunteer transportation network. We also received funding and we received help from Missouri Foundation for Health to write grants and to continue to look for national and statewide support to build a network. In 2020, we launched the Transportation Network with CARES funding and CSBG support. So out of all the craziness with the pandemic, that it provided an opportunity for us to use that CARES funding just to go out to the communities and see if we could gain support, see if we could find some sort of engagement with a very small investment. And luckily we did. We then took that baseline information and we gained private funding support from Patterson Family Foundation through 2021 until this year. And so that contribution helped us invest in scaling the network, and then also looking at different operators for our scheduling. And then in 2022 until present, we've been blessed with Missouri State appropriations. And again, we've matched that Patterson funding and from small community foundations in the area. And we've been able to pay for the rides. And then continue to build the processes for training, certifying volunteers, and to expand the volunteer network across certain regions or certain counties, excuse me. Go ahead and thank you. So when we were talking about that strategic plan with HRSA, we found very early on as one of our tools to work with communities that we needed to kind of build this value chain. And we needed to identify the support, the supply, and the demand partners. And we found this tool and this mapping to be very effective in not only gaining more partnerships as we brought this to communities, but also building understanding of roles that either did or didn't exist within the transportation network, even within a city, a county, and then across a region. And as you can see here, our supply partners are public transit. We work with public transit providers. We work with private services that exist and volunteer transportation networks. We looked across the nation to find best processes. Our support partners were community funders, local governments, transportation, state support, and then referrals from health workers. We were kind of getting an idea of what that demand would be and how the demand for rides needed to also allow people access to not only non-emergency medical, but to those services and those resources in communities such as their local bank and grocery stores and even, local services. Then we looked at those demand partners. And again, we assumed in the beginning it would be a lot of clinical health clinics, FQHCs. And then we quickly saw that diversify with employers and even educational opportunities that existed in the region or outside of the region. Social services, we understood that demand. We brought that to the table. But then we quickly saw the demand coming and the interest coming from our senior center that existed in the areas. And so by identifying those demand partners, who those were very early on in the project, we became very human centric and very focused on riders' needs and the customer service that we needed to build to provide a robust network that would add to what exists and fill in the gaps. This was another tool that we used when working with communities to start telling the story. So we're building the partnerships and the stakeholders, and then we're starting to go out to the communities to build support financially, and then also to recruit for volunteer drivers. And so we really wanted people to look through the lens of transportation many different ways. And so this information was pulled from dozens of data sets. census and consumer marketing data, as well as location data. And then it was connected with vehicle data. I'm using data a lot, but what it tends to provide us is a built environment that shows us, by using economic data and consumer spending, how we can start to shore up the need for transportation. So if you look here on your left, the purple screen, we started understanding and listening and hearing that, a lot of people needed access to medical appointments. And what's unique about this is that the darker the pink is, or mauve color, that's density of individuals living in those areas that are 50 and older. And then we mapped out all of the clinics that were available. So the green pluses are, walk-in clinics, just medical clinics, and the H's are hospitals. And what you see here in this map is that you've got a density of older individuals to the right, where there are less medical providers, in comparison to the left, where you even see some areas like down here in the bottom left, Vernon County area, that are almost white. And so instantly we could see a disconnect, and we could start to gauge the demand and see the distance that people needed to go to access medical care. And then on the right side of the screen, you'll see we looked at unemployment and small and large employers. And when you look at the areas that are dark orange, if not red, those are saturated areas of high unemployment. And then you see these blue dots. And if it's a large dot, that's a large employer. And then if it's a smaller dot, that's a small employer. And so what we were showing here was the disconnect, where we had areas that were orange, that had large populations of unemployment. And within those areas that were a much shorter distance than what was originally assumed, was we had small and large employers in those areas. And so that showed us that we had an opportunity to offer transportation outside of standard operating hours that we saw with a lot of public transit providers that were primarily running from 8 to, let's say, 3 or 4 in the afternoon, when primarily in these regions, people working shift work, it starts as early as 7, can end at 3, or go 3 to 11. So we needed a transportation resource that would fill in those gaps. So with our partners, with community education, with talking to funders at a regional, state, and national level, we identified the volunteer transportation network as a solution. I talked about that original $20,000 that we used from CARES funding, and we went out across these communities, and lo and behold, we found volunteers. We had a lot of skeptics out there, but what we find is that in rural Missouri, people are interested, and they do see a volunteer driving network as providing purpose, but more than ever, they understand that this is something that they can sustain. So let me tell you a little bit about our model. We offer mileage reimbursement at 65.5 cents a mile. That is non-taxable income, because this reimbursement rate is stipulated by the IRS. Drivers carry liability insurance. Additionally, once they become trained and certified in our model, we provide supplementary insurance to offer additional coverage. We do full background screenings. We do we must have a valid license to apply even. And we also do a 15-year driving record screening as well. And what we find is that volunteer drivers tend to like this model because it's very flexible. It has flexible hours. We say we don't really have operating hours when we provide rides, because what we do offer is flexible hours. So it could be nights, it could be weekends, it could be maybe they help for 2 months, but then they head south for the winter and they're gone for 3 months. So it's very flexible to those volunteers. Currently, we're blessed. And this year we have 44 current volunteer drivers, and I'll share numbers about those rides shortly. So let's talk about the ride scheduling process. This gets into a lot of mobility management. So clients call us directly to schedule those rides. We're open Monday through Friday, 8 to 4 p.m. We allow the caller time to tell their story. Oftentimes, we're working with individuals that are in crisis, either from they desperately need access to food, medical, and employment, or sometimes they're upset because they've tried multiple venues and neither of them have worked. We confirm that appointment time with them twice in every call. This again is very important due to the mindset of the rider, and the rider dictates the length of the appointment. And so also destinations with exact addresses. This has been a little challenging in Missouri. We have a lot of county roads, and so we work when they call in, we instantly bring up that address on Google Maps. And so due to just different technology and some of those individuals that live very isolated, there's a lot of work that's done on finding some of those exact addresses. Another thing is that we want to ensure the correct drop off and pickup. A lot of people maybe don't go to these large medical campuses and they say, take me to Cox in Springfield. That's a campus. So we use, we find out the physician, we have a list of those physicians that exist at St. Luke's, KU Med, down in Joplin, at Freeman, Mercy, and then at Cox and Mercy in Springfield, and even Columbia. So we kind of can find out which doctor they're seeing and which building they're in. But I can't say enough about this team, the ride scheduling team, because the coordination services that they're offering, they're also working with individuals to ride share. So maybe they're going to the same destination. We have some individuals that go to an adult daycare and they go across 3 counties. And so we try to coordinate those rides. So we're ride sharing. We also work with individuals that maybe they have an appointment, and instead of making another trip the next day, we try to get them to consolidate those trips. So maybe they can go to a doctor's appointment, then they can go by the bank, and then additionally they can go and they can stop at the grocery store. But this is part of the beauty of this concept, is that we're advocating for community mobility. Instead of making an additional trip and staying siloed just for that medical appointment and then another trip for the grocery store, we're trying to consolidate, we're trying to reduce emissions, and we're trying to create something more effective. And we do this by the mobility management that we offer through our ride coordination services. Train and certify volunteers. This is probably one of my most favorite things to do in this program. So I love learning all the stories. I love getting to meet these individuals that step up to the plate. They step up to the plate, they want to help their communities. And so originally in that process, we start by screening their backgrounds. Their vehicles are inspected at least 2 times per year. So one thing about the vehicle inspections, and I have inspections with an S, we have individuals that register 2 vehicles. So they might have one vehicle that they use in town, they have another vehicle that they register for the long trips. And so those tend to be trips that with vehicles that have better gas mileage. We also have some individuals that use vehicles like 4-wheel drive and stuff like that. So I think that also speaks to where this model is very driven by rule. Majority of us are fortunate and do have more than one vehicle. We also have a HIPAA policy that's been adopted by our board. There's a little education that goes into HIPAA as well in that training process. As we've developed the model, we found that we provide a package of tools for those volunteer drivers, and they include seatbelt extender, first aid kit, flashlight, and paper voucher materials. So we provide them with a folder that has emergency paperwork, a paper voucher in there, in addition to a little pocket that holds any receipts. So if any of our volunteers have to be on a toll road, they incur expenses such as parking, we reimburse them, but they have to turn in the receipts. Additionally, if they go to an appointment that's, let's say the rider has said will take 2 hours and the appointment is taking something like 4 hours, if that volunteer driver goes and has a meal and up to $15 a meal, then we will reimburse that volunteer as well. So while we can't reimburse them for their time, we do recognize their dedication. And so these training and certifying volunteers is all done in person. So we travel throughout the region, we meet individuals, and we often tend to keep those training sessions very small. This would be considered a big one in the picture with 3 people. So we're, like I said, we're reviewing HIPAA, we're going over a 17-point font handbook, so it's about 25 pages. We're understanding the roles of both the rider and a driver, because what we want to make sure is that that experience is positive. We are bringing public transit, and we're really starting to engage and change that social context. So we want everybody to clearly understand their roles and expectations. And then of course it's inspecting vehicles. It takes a little bit. So let me talk to you about our technology. Currently we have all of our drivers using a tablet, and we're fortunate enough to purchase these tablets for $1 from Verizon. And they engage on what we call the SNAP app. And the SNAP app was created for volunteer drivers by Volunteer Transportation Center. And we work cooperatively with this organization, and we schedule inside their platform. And then the ride reservation is pushed through API, is pushed over then into SNAP. And SNAP is an innovative piece of technology that we love. So you can see here, there's a screen, and the volunteer driver signs in, and then they enter their PIN, and then they begin to log the trip. And so we have a geo map of every single trip, from the moment that driver leaves their driveway to all the pickup drop off destinations, and then back to their home. And so I think this brings an element of security to the model. We had an individual, this is a great story, reach out, and she said that she had a volunteer driver that provided a ride, and that the ride should have taken 20 minutes, and that she felt like it took an hour and a half. And of course we were very concerned. Actually, her social worker had reached out. And so we pulled up the ride, all the completed rides in the last 6 weeks. We could see who the rider was. We could see what time that they dropped off that individual. And what we found is that all of those drop-offs were in 3 minutes of each other. There were 3 different drivers, and we could see their routes because the Google GPS map shows us a breadcrumb, and we could see that route. So instantly we were able to work with that individual, their social worker, and kind of find out what was going on and address that need a little differently. But what we felt good about as a team was that we had that security. We had that map to back up anything, to see what was happening, and then everybody could kind of understand and get on the same page. So every night after rides are completed, our team attests those rides. So we complete all the completed rides. We then review all of those, and we upload that. And then we, of course, store and back up every day. So there's definitely a training that goes with utilizing the tablets. And for some individuals and our volunteers, they've never actually used a tablet before. So our team, we walk them through, we have job aids with them. We do a test trip. And so we, as much as we can in that training session, we try to address their needs. And so, but I can't say enough about this tool and how innovative it is for volunteer transportation networks. And it is fairly easy. We'll be doing another upgrade this fall. So, and additionally, all the volunteer drivers receive all the information about the rides on the protected network of our agency. So, they receive their email, and they have all everything they need, maps, camera, and this app are all downloaded and ready for them in this tablet. If we have volunteer drivers that utilize Android phones personally, they can also upload this app. And we do have 2 drivers that currently don't use tablets and they use their Android phone. So we're hoping in the future this will be an expense that we can eliminate once we start to work with drivers more and they become more, it could be more convenient to utilize your personal cell phone. So let's talk about the data and the numbers and if this is working. And I've got some statistics here for you that I think are really interesting. So these are from January to August of this year. And one thing I think is interesting here on the left is you'll see the average age of our client age is 63. And so we tend to offer rides to clients as young as 18 and as old as 101. And so we're definitely a diversity of age, but our average age tends to be at that 63. So total miles you'll see on the bottom, I'm on the graph on the left, you'll see here on the bottom is like a yellow mustardy color. We took a downturn in February. That's pretty typical with winter. When you, and then you see it steadily increases throughout the year. May, June, July, August, those are your peak months. And depending on September, those are your peak months for transportation. That's just an industry standard. And as you can see, we had an arc from February to March. Well, the weather turns on. We had a lot of people that were accessing a lot of medical transportation and seasonal employment then. And you see it steadily, remain average, if not go up. And what's also interesting is, so those are our total miles. And then you see on the blue graph are our total trips, which we see those increasing, but you see them go down at points. And so maybe the trips are going down, but our distance is still going up. And so that is part of what we've been saying from the beginning. Rural transportation needs a different approach because it's more about distance. Your biggest challenge is distance, not density. And so I find it interesting that in this research and the data that we're seeing out of the volunteer network that this is true. On the right is trips by destinations. And on the far right, you'll see that on average, the blue is the medical. And you're seeing that there's a very high need in medical. But on the far right, you're seeing that food is the yellow, and then employment is the orange. It's the shorter one. But food and other tend to be second place in those demands. And other, we're finding, is everything from needing access to a local civic event, access to a court appointment, or even access to a local bank. But consistently, if you look here at August, especially, we're starting to see where there's still quite a bit of need for non-emergency medical. It's always about half of the rides that we provide, but then you're starting to see employment and food retail are starting to level off. 132 rides, 167 rides. And I think that's really interesting. Early on, we talked about employment, and those employers were requested to be at the table in that strategic plan of the transportation model. And so as it grows, we're seeing more demand for employment. And what we see are individuals with developmental disabilities are working part-time in the communities. I can think of another rider we have that she had some repairs on her vehicle and she needed about 2 weeks she needed a paycheck. She needed to save money on a paycheck before she could get her vehicle repaired. And so we found a volunteer that worked with her for about 3 weeks, provided transportation to and from her shifts. So this didn't alter her employment, and she was able to stay employed and then able to fix her vehicle. So lots of demands. But what I think is interesting is we're seeing some of these level out, and we're seeing these opportunities and those original tools we used where we were mapping transportation needs for non-emergency medical and for employment. And so this is rider data. Whoa. Oh, there it is. And so when you we figured the average trip is about 45 minutes from the time the rider leaves their home to pick up and drop off. And so we take that 45 minutes divided by the miles driven by every volunteer driver. And that's how we come up with our volunteer hours. So this program already this year has, we have 35,000 hours that individuals have donated to this program. And in the nonprofit world, that is an in-kind indicator that we love to see grow. Current active volunteers, yeah, we are down to 38. Earlier, I said 44. And I think this brings up a good point in a volunteer network. There's an ebb and flow. We've had some volunteer drivers that have unfortunately fallen ill to major sickness. We've had some that have taken off because they need to be caregivers. We've had some that are heading south already, so for the winter. But I do think what's interesting is even with that swell of having drivers, losing drivers, recruiting, we in the last 2 weeks we added 4 more drivers, is that recruitment and certifying volunteers is nonstop. And then it also provides weeks when other volunteer drivers can maybe carry or take on more rides than they would in the past. So that, again, that flexibility is what helps grow this model. The average age of a driver is 65, and currently we have about 40. Yeah, we have about 40 vehicles that are certified. So some people certify more than one vehicle. And I want to talk to you. I always think it's important to feature a volunteer driver. And this is Thelma. And Thelma is a Cedar County resident. She prefers to drive local and occasional long trips. We have some drivers that just want to stay within their community. We have other drivers that just want to do the long trips. They want to take people out of the region to those major metropolitan areas. It's always up to the driver because the model allows for flexibility. She likes to do both. She averages 15 rides a week. And I think that's pretty exceptional. She kind of has a steady clientele of individuals that have monthly appointments. And that can be anything from, accessing grocery store. It could be going to resources in your community, as well as going long trips to certain medical outlets. She was trained in the fall of this year. And one thing I like is her quote: "I like helping my neighbors. Doing this gives me purpose. I retired from nursing and I enjoy helping people." And this is what we're so fortunate to find. We have so many individuals that in their professional career, maybe they were a truck driver or they drove for a distribution supply warehouse. But we have all these individuals that find that this model provides purpose, but also aligns with those skills that they developed in their professional career. We've got a stay-at-home dad, and he provides transportation while his kids are at work up until 1:30. So we know he's available 4 days a week. He coaches soccer of an evenings and runs the kids to school. So we have a lot of different drivers that come from a lot of different backgrounds, but one thing they all appreciate are the relationships that they build with their riders. The riders sometimes, I talked about riders being isolated and stranded. A lot of times with that isolation and being stranded, those riders tend to have a little social anxiety. And so they get to know, they trust. When they call in, they ask for Thelma. Those individuals in Stockton, Missouri, who know Thelma, they want Thelma, and when Thelma's available. And so that's part of those ride coordination services we offer. This is just Thelma, and she's available on Tuesday, and she's got 4 requests. So everybody's going to have to, ride share a little bit so she can get everybody where they need to go. But again, this is a very community driven approach. And we tend to see that people are appreciating the service. They recognize the support networks that they're building. And I just want to share a couple comments from some of the riders that we just collected as third quarter of this year. Some of those were: "I'm very grateful that this exists. I have a serious illness and I am now grateful to make my appointments. Another one is, this is a great service and it helps me out a lot. Being disabled, I am on a strict budget. And a final one I wanted to share was, this person mentioned a community has no public transit. And I really appreciate you stepping up to the plate to help us out. And so I just hope that we all can recognize the effort by Thelma here, and how she steps up to the plate each week. And we do reach out and get customer service feedback. We get it every 3 months. So once a quarter, we call 10% of the riders, 10% of the riders in our network. And we have a 6 question survey. We ask them about the service. We ask them about the kindness of the individuals that take the call, as well as was your rider courteous? Were your needs met? And then we also allow them to share comments. So we do that every quarter. And on the next slide, this is a great slide that explores the public and private investment partners. And so as this model grows, we will continue to be both publicly and privately funded. You can see that we've got partnerships as large nationwide, like Verizon. And then you'll see over here, we've got Dallas County Community Foundation, the Commission, a local bank. We've got Vernon County Commission, another local trust. And so again, this appeals to that local ownership, the regional and statewide ownership. We've got state support with Patterson Family Foundation. And then of course, the Missouri state appropriations that we've received the last 2 years has really helped us scale and be able to invest in the tools that make this possible. And then we have Care Connection and On My Own, and they service that demand partner of those senior centers, where we heard very early on in our development the demand for these services. So that is all I have to say as an overview about how this model was developed. Then additionally, how we've kind of deployed it, launched it across these regions. But I'm here to ask any questions you might have, or to listen about feedback you have about rural transportation in your area or the challenges that you face.
Thanks, Kelly. And I'll show that slide again so you have Kelly's contact information, but I wanted to monitor the Q&A now, or chat. I don't see any questions yet, but I know you may have some. While you are throwing some things in there, I wanted to, Kelly, could you tell us a little bit more? Like, I understand with Care Connections, that's the group that operates senior centers across the region. And if I'm correct, they've contracted with you all to provide rides. So that's another private public sort of effort, right? Contracting with organizations like that to provide rides.
Yeah, so they had a small volunteer network that existed within the senior centers, and they wanted to expand it a little bit. So we came on and we started working within 6 senior centers in our region. And we came in, we recruited, we worked with the volunteer drivers that they already had engaged. We brought them onto our system with the tablets. And then we offered longer hours for ride coordination, because some of their senior center directors were doing it, but they're wearing so many hats. And so they felt like they could expand their services by having our team do the ride coordination calls. So we contracted relationship with them. We invoice them monthly for the rides that we provide. Luckily, we have wonderful software for scheduling. So they have requirements that they need for funding from their funders. So in our report every month, we break down those requirements that they need.
One of the questions that just came up from Ashley Wilson is about wondering about a tentative date in the next year that you might go to those other planned counties, how that and you're asking about the planned counties. And if you could list those again, Kelly, and talk about how you are going to be working and going there.
Yeah, so Dallas, Polk, and then Barton and Jasper.
And
I feel like And Camden, like I'm forgetting one. We have already started conversations in the Barton, Jasper County with United Way. We're looking for that partnership to work on referrals in the region, and then to already start to address the sustainability factor. You know, what can we do to launch this program and sustain it? We're very active in Dallas County. We've spent down the local funding that they provided. So we've already got like 5 volunteers trained in that county. Polk County, we've met with the economic developer in that area. In Camden County, we're working with Ed Thomas and his through the SB 40 board there. And those meetings will start this month. So we're actively getting out, meeting kind of similar to what we did with our original approach. We get the stakeholders involved, find out what it looks like in their area to launch the network. Then with those stakeholders and their endorsement, then we move forward with recruiting volunteers. And we don't spend a lot of money on marketing. We haven't ever had a lot of money to spend on marketing. So through word of mouth, brochures, and referral business cards is how we tend to start. And then we get enough demand. Believe me, we get enough people between social services, your medical, your court system. We get a lot of referrals. And then we start to basically book rides for volunteer drivers. But our capacity is based on the number of volunteer drivers. We didn't know this until we were in the process for a little over a year. We didn't know which comes first. So getting those partnerships are key. And then from those partnerships, finding and recruiting volunteer drivers.
And can you clarify along those lines how much local funding is needed along with the Missouri appropriations? You talked about pots of funds, right? Or and do the healthcare providers pay for rides, or who ends up paying for rides beyond the public funding that we've been able to get?
So we see it, it's very diversified between communities. So a local we've had foundations, and we always advocate for community mobility. We don't want to silo and just collect funding just to take somebody to and from the doctor's appointment. So we want to be sure that we're getting funding that allows people access to everything. So we see local foundations, local community foundations. We've received funding from banks, and sometimes, like in Dallas County, they were able to collect $5,000. That $5,000 was spent over 4 months. And then additionally, we were able to apply through METAP, a state fund, to help match the funding that they collected as a community. We were granted a portion of that. And so we're just kind of patching funding as we go. We did have a community foundation and one in Vernon County, actually Moss Trust. They granted us well over $20,000, and that lasted over a year. So and currently our ride coordination services are being supplemented through the state appropriations. So for our contracted partners, we then charge a rate per mile. And there's different ways we can charge that. And that covers the ride coordination fees and the reimbursement to the volunteer driver. So we kind of have diversity of who we serve and where we go, and diversity in funding. But I think that's how you make this work.
Great. We have 2 questions. One is, how soon do the riders get a confirmation, the riders, that they have a ride?
Yeah. So we ask, great question. We ask riders to give us 48 hours in advance notice. And then we try to give them confirmation within 24 hours at least. So sometimes we get people who will confirm, and you can only schedule up to 2 weeks. So some people have very consistent schedules with employment and school. And so they schedule 2 weeks out. Now we get a confirmation on those very quickly, especially if they have a regular driver. And so just your one-off trips, usually we can get those scheduled within a day. And like I said, we had been scheduling Monday through Thursday. And last month we expanded our scheduling services to they are available Monday through Friday, 8 to 4.
Great. Another person, Joel Dermott, said he's in Barton County with the health department. He sees the need, he thinks the program's awesome and wants to know how can he help? What do you need from us?
Yes. Jewel, I will be reaching out to you, if not coming and seeing you. This week, actually, we have a team member, Lakin Coleman, who is going to be out, and she will be bringing brochures. So I will reach out to you, Jewel. Maybe try to call you by phone, actually, and visit with you a little bit and see if we can strategize about some community events coming up. And some of our staff go to a lot of the local events, health fairs, fall festivals, even civic. We're available to come and speak to your small group, even if it's a small women's group, it's of an evening, it's over lunch or breakfast. We do a lot of presentations about the network, and that's how we recruit volunteer drivers. So Jewel, I know there'll at least be one person dropping off brochures this week, but then I'll be sure and try to connect with you.
Great, and I'll get the name, but it's Jewel Dermott. And again, as Kelly said, it's really a matter of plugging into a county so that you can start building that volunteer driver network and the referrals. And without a lot of marketing, you start getting rides going that way, and then building awareness for possible funding locally as well. All right, another question is, did you say that the rides are free, or does the cost vary from county to county depending on funding?
So currently, our volunteer transportation network, drivers cannot accept payment from a rider. That's due to our insurer. So those rides are paid for in advance. And so the cost of the beauty of this model is that there is only ever an expense when a ride is delivered. It's not a bus stop that sits out, or it's not a large passenger bus. We just have overhead and the miles driven. And so it's 65.5 cents is the reimbursement. And we do take individuals from where they live in this region to other counties. And so as for ride coordination services as a contracted partner, there is a different price for that. And so it varies based upon which services that you would like as a contracted partner.
So an individual calling you up, they would learn how much they need to pay for the ride, or
No. It's all paid for. I'm sorry. Thank you, Patty. Their rides are paid for up front, and then we pull the funding out of different buckets based upon the requirement. So for instance, like in Dallas County, you had to be a Dallas County resident. And then there have been other funders we've had that have had stipulations on the destination. Like it could only be for medical, it could only be for food accessibility, and it could be in the home county and the adjacent county. So this is all very deep into the details, but what I'm trying to tell you is that our ride coordination team and our technology lets us pull out of different funding pots, which helps us to provide transportation.
Right. Okay. I think we answered that one. And I have one too, just a clarification too. I think this is a really, the drivers are reimbursed per mile, but that's including what you would call deadheads. So
yes.
in our rural areas, they often live a little ways from where they might pick up someone. And can you talk about the importance of that and how that figures in?
Yeah, definitely. Thank you. And I love that Patty knows all these aspects. So there's a lot to it. So I appreciate that's a great question. So yes, they're paid from the time that they leave their home to the pickup, and that is considered deadhead. And so being that we live very long distances, if we didn't reimburse for that mileage, they would be out personally. That would be an expense, and they're already donating their time. And so we have geolocated the home address of every single one of our volunteers. So when you go into our scheduling platform and we enter the residency or the first pickup of that individual, we can see in a color-coded map which volunteer lives in that county. And so that helps us to schedule the closest volunteer to that that pickup destination. So we have volunteers that live all over our counties and we love it. And then the ones that like live in town, their priority would be all the short runs inside that community.
Thank you. Yeah, I think that's really interesting that the program's been able to make that happen, because that's a challenge, in a rural area.
Yeah.
Here is another question. What is a contract provider? Would this be a medical clinic, a health center?
Oh, yes. Yeah. Medical clinics, health centers. We work with independent living organizations, adult daycare, and even like that senior center. So, and if you're interested in that, please email me and I would be more than happy to visit with you and some of my team and kind of understand what your needs are. We even on the contracted partners, we have partners who say, okay, I just have $30,000 and I have to spread that money across 12 months. And so then we know how to allocate those funds to meet the needs of that entity. So we can be very adaptable to what a contracted partner's needs are. But please email me and we can visit.
As you said, employment rides are growing and a factor, and an employer could actually be a contracted partner as well, right? Providing coverage to help people get to those PM shifts and things like that.
Yeah, that's a great point. We worked with a partner in one of our counties and he had an employee. And so actually that employer made a donation directly to our organization, New Growth Transit. And so I think we see a lot of people, but that was just a temporary need that they had there. But yeah, we have employers that, we could be on retainer and then we would just invoice that employer for that need. And with that, though, employers could also ride share. So we have a lot of seasonal employment in this rural area. And so if they had a swell of staffers that they needed to bring in during these couple weeks or months, we could ride share, coordinate a volunteer and bring them in. But the contracted partner or the employer is only billed the mileage, the coordination and the mileage reimbursement per mile. They're not billed per person. So I think that's what's also affordable with this type of transportation.
Great. We're open for a few more questions with a few more minutes. I have a request for Kelly to just maybe restate how we didn't just make this all up, right? We are learning from and working directly with a group in New York that has a very robust scheduling system. We've also learned from the Missouri Rural Health Association. So if you can just kind of sum that up a little bit.
Yeah, great point. Another great point, Patty, is we didn't want to reinvent the wheel. Isn't that a funny, it's a pun there, but we just wanted to create access. And so we were able to basically research in that time with that funding we had, and we developed a partnership with a Volunteer Transportation Center out of New York State. They've been around for 22 years. They have over 300 volunteers. And you guys are not going to believe this, but they're in 3 rural counties in the upper New York State, and they provide hundreds of rides a day. And so they had some built processes, and we were able to absorb those, make them our own, share back and forth cooperatively, and then be a part of their technology. And so there are so many volunteer networks that exist, even in the state of Missouri. There's 3 others. And so I would encourage you to research. And one thing that's consistent amongst all these volunteer networks is they are highly effective in rural areas and they are sustainable. And I think for those individuals that are isolated and stranded, it's one of the best solutions that exists.
Well, we are excited to have it going and growing here in this part of Missouri. Again, New Growth is Rural Community Development Corporation. Our parent agency is West Central Missouri Community Action, and the board and our director have really been really incubating and helping grow programs. And along with New Growth Transit, at New Growth, we have micro enterprise financing and small business assistance. food systems program. So you can learn more about all of it at newgrowthmo.org. I'm going to put up the contact information slide again to reach Kelly directly to talk about partnering in different ways. And you'll be getting an email. This will be posted at our YouTube channel in about a week or within the week. And there's also a link in your email that you'll be getting to an existing video about the program. So watch for that in your email. And I'm going to share the screen so you can look at this contact information again. Thank you all for joining us, and look forward to working with you all in this effort. We'll leave that up for a couple minutes, and I think we'll close there. Anything else you want to say, Kelly?
If you're passionate about rural transportation, give us a call. We want to help you and help the residents in your communities gain access that they deserve.
That's right. Okay, thank you, everyone. We will again be emailing you about this, and we'll include this contact information in your email. And again, contact us anytime, and thanks for joining us. All right, I will end it there, and all the best. Have a great day.
Thank you. Thank you for all your help.